the first thing that you do with any question in the reading part C is you read the question. When you are reading the question, you are trying to find out what type of question it is. So the most common types of questions you have in the reading part C are attitude and opinion questions. So apart from that, you can also have purpose and main idea questions. So these four are the major categories of questions that you get in the reading part C. Once you have read the question, you go to the paragraph. And when you go to the paragraph, you try and find out the topic sentence of the paragraph. So how do we identify the topic sentence? Will every time the first line of any paragraph be the topic sentence? How do I identify a topic sentence from the paragraph? What are the characteristics which would help me understand that, yeah, this sentence is the topic sentence? Yeah. So should I assume that none of you knows how to identify the topic sentence? How would I identify the topic sentence? And if you can't identify the topic sentence, then how are you going to get the writer's opinion or attitude or main idea of that paragraph? Because the basic skill you need is to be able to identify what is the topic sentence. So when we did the reading part C last time, I taught you that how would you differentiate a topic sentence, right? So the topic sentence should not be a fact. It should look like claim or argument. So here you should be able to identify the difference between the fact and the argument. And we did some activity to help you identify. Yeah, how do we identify the difference between the fact and the argument? Fact is, it can be proven. It will have some statistics, evidences, and something that cannot be challenged. So if I say, hepatitis A virus affects the liver, so it is fact. Nobody can challenge that, right? But if I say insulin can also be given in oral form, okay, or it can also be given in the form of tablet, then it is a claim or an argument. So the claim and argument is more likely to have adjectives and adverbs in it, because it is writer's claim or it is writer's viewpoint. So arguments or claims will have adjectives and adverbs, whereas the factual sentences will have statistics or data that can be proven. So once I have identified the fact, what is the next step? Or sorry, once I have identified the topic sentence, what is the next step? What do I do after that? Look for supporting statements. Yeah, true. So once I have identified the topic sentence, so this is the skill of reading the paragraph in reading part C. If you will not follow that strategy, what would happen is you are likely to get confused. You are likely to get confused with the sentences that are given within the paragraph, because you might consider all of them to be the separate sentences. They are not a separate, they are not separate ideas given. They are, the whole paragraph is presented as one single idea. So how do I identify that? Okay, is only if I'm able to understand what is the topic sentence, and then the writer would go on to give some supporting details. Now that supporting details can be in form of some supporting ideas. It could be in form of data, it could be statistics, it could be studies. So those will be considered as supporting details. Now, the supporting details can be in any form. It can be supporting idea, or it could be subtopic, it could be data, it could be statistics, it could be research, okay, study, or it could be also quote from some famous scientist or famous researchers, or it could be quote from some organizations like WHO or some reputed organizations. And writer would use this statistics or the data to either support his argument or to present an alternative argument. So that is what you have to find out next. Okay, once you have identified the topic sentence, you go on to look for the data or the supporting details, and you try and find out whether those supporting details are in favor or are against the claim that the writer is trying to make, or are they in favor of the general topic or are they against the general topic. And when you are looking for in favor or against, there comes the role of adjective. So again, you look at the adjective and you see the intensity of the writer's feeling with the help of adjectives that writer has chosen. And then what you do next is you write a summary sentence. Write a summary sentence that helps you to present this entire paragraph or the ideas presented in this entire paragraph as one sentence. So that with that summary sentence, the third step for you will be to go to the answer choices, and then you use your macro skills and micro skills that we discussed to eliminate wrong answer choices. Right, so let us do this one question, and let me help you understand how can you apply the strategies that you have just read. So if you look at the first sentence here, countless lives have been saved since blood transfusion were first introduced in the 17th century. Is this a fact or a topic sentence? It is fact, fact. Yeah, so if it was a fact, wouldn't they give the numbers here instead of saying countless lives? The expression 17th century gives you an idea that it could be fact. But if it was a fact, then it should have a statistics, right? How many patients or how many lives? So the word countless is an adjective, and that tells you about the writer's viewpoint, right? Of looking at a situation. So this entire paragraph is about blood transfusion. So definitely the writer is giving out the view and opinion. So all of you are citing this as a fact, but this is not a fact because of the word countless. Countless lives have been saved since blood transfusion were first introduced. So how can I prove the word countless? If it was statistics, it can be proven. Then it would have been the fact. But here the word countless, which is an adjective, gives you the writer's feeling towards it. Right? Now the feelings also could have intensity. So if you look at other sentences, okay, now this is supporting detail that initially some medical communities were hesitant, but they were soon seen as vital. So again, vital is an adjective. through for the blood transfusion or for the blood to replace the blood which was lost through trauma, illness, or in the operating theater. Then again, the writer uses transfusions are a medical marvel. So, medical marvel, marvel again is adjective that the writer has used. And transfusions also represent a lifeline for people with inherited blood disorders. So, lifeline is also the adjective that writer has used. Now, adjectives too can have a degree. When I say, okay, this is nice, okay, and when I say this is beautiful, and when I say this is awesome. So in all three words, I am presenting positive feelings towards it. But are they representing the same kind of feeling? Do I have the same feeling when I say nice? Do I have the same feeling when I say beautiful or when I say awesome? The intensity of my feeling changes, right? So similarly, when you are looking at the adjectives and adverbs writer has used, look at the intensity of writer's feeling. So instead of countless, he could have said many lives. Instead of vital, he could have said essential or necessary. Yeah, instead of saying medical marvel, he could have simply said it is useful. Lifeline, he could have said helpful. But look at the adjectives that he has chosen. All of them are extreme, right? That shows me that he feels too good about blood transfusion, right? And if I try to give it in percentages, I would say this is about 80 to 90%. It is like awesome. When I say beautiful, it is 70, 60, 70%. When I say nice, okay, I just don't, it is just that I don't dislike it. It's good. But when I say awesome, that means I like it too much. It may be 95%, 90, 95%. So similarly, all the adjectives that writer has used here, countless, vital, marvel, lifeline, okay, and they are all used for the benefits of blood transfusion or how the blood transfusion has been helpful. And then the writer is presenting one more idea by saying that nowadays or recently we have started appreciating that it comes with its own risks and drawbacks. So now if I had to write a summary of this entire paragraph, can I say that the blood transfusion is useful in illness, trauma, in operating theater, or certain blood disorders, or patients who are on certain therapies, although it too has its own risks and drawbacks. That becomes my summary. Now, the next step for me is to go to the answer choices, okay, and use micro skills to rule out answer choices which do not match with the summary sentence. So here, if you look at these sentences, you can see here option D hasn't always been regarded as a suitable treatment. Now, if you look at the writer's viewpoint, all the adjectives that writer has used are very much positive, whereas option D goes exactly negative, hasn't always been regarded as a suitable treatment. And the word always is making the difference because it does say that there are some risks and drawbacks, but now we have started to appreciate that. If I say hasn't always been regarded, that means right from the beginning to till now. So this information that is given here is contradicting the paragraph. Okay? So it contradicts the paragraph and therefore it is wrong. Then was developed primary for use during surgery. So you can find this sentence as it is, isn't it? Developed for the use during surgery. Here also you can see that it says it is used in operating theater. So this matches, but it is one supporting detail and not the summary. So that is the reason why this answer choice is wrong because it is true according to paragraph, but what I'm dealing with at this stage is not true, false, not given questions. I am dealing with main idea question, or I'm dealing with opinion question, right? Writer makes the point that blood transfusion. So writer makes the point. This is main idea or writer's opinion that I have to find out. Then there will always be some of the answer choices which will make unnecessary comparison. The paragraph may not be making any such comparison, but the answer choice will go on to make those comparisons. So here you can see is needed now more than ever before. That means it is a comparison of the requirement of blood transfusion in terms of times. Now, current times and the past. But here in the paragraph, there is no such comparison. There's no such comparison whether the number of blood transfusions have increased or not. Right? So that helps me to rule out this answer as well. And even if I go with my summary sentence, yeah, so that is impressive because you can see the adjectives writer has chosen. Countless, vital, lifeline. Okay, so the writer is impressive, and range of functions because it is mentioned that it is useful in trauma, it is useful in illness, it is useful in blood disorders, it is useful in operating theaters. So the correct answer choice will always be inferential because it will summarize the main idea presented within the paragraph. So what happens a lot of times is because students do not understand this strategy, they go on to match sentences, they go to and fro and match sentences with the paragraph, and then they end up choosing the answer. And most of the time when they come out of their exam and when I ask them how was your reading, they would say, I did just really well in the reading and I'm gonna pass this reading test for sure. I'm going to pass this reading test for sure, ma'am. There's no doubt about it because I could find all the answers very easily. So, what they mean by finding all the answers easily is that they were able to match the sentences with the paragraph. And then finally, when the result arrives, they end up failing the test. Okay? So, do not take reading part C for granted. You may get some answers correct with the tactics that you are using, but if you really want to pass the test, it's important that you go with this strategy. Otherwise, there are very high chances that in exam you may feel that you did really well, but you will get tricked by the test because the test is designed in that way, which can easily trick you, right? So do not match the questions. Try to go for a summary. So what is the topic sentence in this paragraph is this: countless lives have been saved since blood transfusion were first introduced. And then the writer is giving out the supporting details how countless lives have been saved because whenever the blood loss was there, it is used for trauma, illness, inherited blood disorders. So these are the supporting details that writer is using to prove his point that blood transfusion has been useful in saving lives. So first sentence here happens to be the topic sentence, but not every time the first sentence would be the topic sentence. Sometimes first sentence would be a background sentence. Like here the topic is so easy, isn't it? The blood transfusion. So writer doesn't need to give any generalized information. Everybody knows what the blood transfusion is. But whenever the writer is discussing an unknown topic or less familiar topic, then usually the writer would start that paragraph by giving out some fact, like by saying that statins are used for the treatment of heart diseases. So statins are used for the treatment of heart diseases is fact, but there would be some professions who would not be aware about it, right? If you think about physiotherapists, dentists, they may not be very much aware about this. So there will be some topics from physiotherapy or dentistry which you might not be aware. So in those cases, what the writer would do is one sentence would be about the background of that topic to set up the topic, and then the writer may go on to give out a topic sentence. So you can't rely on this strategy that every time the first sentence would be the topic sentence. No, you really have to check it whether it is a fact or a claim, whether it can be proven or debated, or whether it has any words like the study has confirmed, those kind of words, which would tell you that it is the fact. Right? So here A happens to be the correct answer, and you know that this answer is not repeating any words from the paragraph. So this is very typical of reading part C. Okay? The correct answer will be inferential. It will not repeat the same words from the paragraph. So what happens is, what you do most of the time is, okay, let me look at the answer choices. Okay, this answer choice is not, repeating any words. That means this is wrong. So you rule out the correct answer in the first place, and then you juggle with three wrong options just because you think that they have some words directly from the paragraph. Okay? So don't do that. It is a very bad strategy to deal with reading part C. And reading part C is crucial for your overall score. Yeah, definitely I can explain why option B is wrong. Because B says is needed now more than ever before. Do we see in the paragraph anywhere that the use of blood transfusion has now increased? Do we have any statistics that in 17th century only 10% patients needed it, and now in 20th century or 21st century 50% patients need it? Is needed now more than ever before? We don't have any such comparison in the paragraph. So this is again an easy way to trick the students, unnecessarily making comparison, whereas the paragraph is not making any comparison in terms of how the demand of blood transfusion has increased. In fact, the only comparison that is made here is that so far we did not look at the negative aspects of blood transfusion. But now it is changing, and now we have started to realize that it is as a complicated a procedure as organ transplant, and it comes with its own risks and drawbacks. Right? So what I'm going to do next is I'm going to give you three more such questions, and I want to give you the opportunity to deal with these questions and then answer them. The ideal time that you get for each question should be 2 minutes, but here I'm giving you 3 minutes time, considering that all of you are not yet at advanced level. So I'm gonna set the timer for 10 minutes for three questions. Okay, and approximately after 3 minutes, I would change the question here. Make sure you're following that three-step strategy. First step is to read the question, find out what the question is, what type of question is it. Second step is to read the paragraph, and that's the crucial step. When you read the paragraph, you are reading it to find out a good summary of the paragraph. And third step is then to match your summary with the answer choices. Any answer choice that is representing one supporting detail is wrong. Any answer choice that is contradicting what is given in the paragraph is wrong. Okay? And any answer choice that is not at all mentioned, like B is not at all mentioned, unnecessary comparison is done. So that is also wrong. So now I've got the next question, and you have 3 minutes time. Yeah, you do need to type your answers, but you need to type them privately, okay, so that the other students don't get to know about them. Go ahead. You have 10 minutes time for three questions. So I've got the next question on screen. I'm sorry, it went ahead. Yeah. Okay. And finally, third question. I mean the fourth question, which all of you have to do. So once you are done, you have 1 minute left to do this question. Once you are done, we are gonna discuss this in detail along with the reasons. And I want all of you to type in the answers that you have chosen for all three questions with the question number, please, so that it becomes easier for me to identify whether you have been able to select correct answer or not. Okay, so that's time up. Now let us start discussing the answers for each of this option. It's taking me a while to change the screen. Sorry about the delay. Okay, so let us start with the second paragraph. What is the topic sentence in this paragraph? It is saying writer is suggesting that. So definitely this is also opinion question. Writer's viewpoint about blood transfusion, but specifically about the benefits of blood transfusion. So we have to find out what is the writer's viewpoint about the benefits of blood transfusion. So what is the topic sentence here, and what is the writer's overall viewpoint about benefits of blood transfusion? Tell me whether it is in favor or against or neutral. So type F if you think writer is in favor of blood transfusion in this particular paragraph. Okay, whether the writer is uh, talking more about benefits of blood transfusion, then he is in favor. If writer is pointing out towards drawbacks, it is against. And neutral, what is the writer doing in this paragraph? Is it favor, against, or neutral? I want everyone to participate, so that becomes an interactive session. Yeah, so this is definitely not in favor. Do you all agree with me that this is definitely not in favor of blood transfusion? Because if you see the adjectives, strange, yeah, then privileged. So privileged, when I say I am privileged, it is positive. But when I say, oh, he's a privileged one, then I have kind of negative connotation towards it, right? So the words may also, the meaning of it may also change depending on where they are used. So strange and privileged. Then the writer says that it came without the same level of research scrutiny. So this is also negative. And then the writer says that mere fact that a patient received a blood transfusion was a risk factor, and in some instances it was associated with poorer outcomes. So at least it gives me an idea that the writer is in no way, in this particular paragraph, the writer is not in benefits, not in favor of benefits of blood transfusion. Most of the sentences are against it. Yeah. So that helps me to rule out those answer choices which are in favor. Yeah. Can I rule out this answer choice? A can be outweighed by unreported negative factors. To outweigh means to be more in importance or in weightage. So benefits outweigh negative impacts, but the writer is highlighting that there hasn't been enough research. So he's neither saying benefits are more nor the negative factors are more. Okay. Then here also, if you see, uh, have been conclusively established in most medical contexts. So this is clearly contradicting contradicting what is given in the paragraph, because paragraph says that there hasn't been enough research, and here it says has been conclusively established. So now I have option B and option D left with me. Now the paragraph is saying mainly that the if you compare the blood transfusion with any other form of current treatments, then there hasn't been enough research on blood transfusion. And here also, while citing the example of the study, the writer is trying to say that it was hinting that they carry more risk than had been previously thought. So the writer is trying to point out that we still don't know. Okay, the writer himself in the beginning also said we don't know if there are more benefits or if there are more drawbacks of this. So therefore B is the correct answer, because there hasn't been enough research and we need more research on it. Not D, because D goes in extreme negative, not always guarantee that it is the safest treatment option. Writer isn't saying so. He is not completely against it. Okay, not completely against it, because whatever against word he has used, he's trying to say that there hasn't been enough research on it. He's not saying that there are benefits and there are drawbacks, but people are trying to focus more on benefits and nobody is paying attention to the drawback. No, he's trying to say we don't know because we haven't done enough research on it. And whatever clinical trials we have, they have hinted that it carries more risks than had been previously thought, and it can lead to poorer outcomes. So B is the correct answer, need to be confirmed by further critical investigation. Again, do you see here? It is inferential. You may argue with me that, ma'am, it is not mentioned anywhere. And I agree with you that it is not clearly mentioned. But that is what you get reading between the lines. Okay? That there hasn't been enough research, and we need more research to, to clearly say whether blood transfusion has risks or whether the benefits of blood transfusion are more or the negative effects are more. Because he's neither saying there are no benefits, he's not saying that there are no benefits, and nor he's saying that the side effects are more or benefits are more. So need to be confirmed by further critical investigations. Here also your topic sentence itself was saying you the same thing. So whenever you're getting confused between two options, the best way is to see which one goes well with the topic sentence. So the topic sentence is the main point why the writer is discussing this whole paragraph, is trying to prove that we do not have enough research on blood transfusion. He is not trying to prove the negative outcomes. So that is another reason why D can be ruled out. Yes, because what point writer is trying to make through this paragraph is he's trying to say that we do not have enough research, as much research or scrutiny we have for other pharmaceutical products. We do not have that kind of research for the blood transfusion. So that is the reason B is the correct answer for it. Then the next question, question number 3. It is just taking me a while to change the question, so please Bear with me. Yeah. So here again it says what point is made about research into blood transfusion. So this is again writer's viewpoint, or you can also consider it as main idea question. Research into blood transfusion. So here also if you look at the topic sentence, research up to now has been far from comprehensive. That's what I exactly said, that you may argue with me that paragraph 2 does not say the need for further research. So it would not be mentioned, but it is the reading between the lines that you get, because the topic sentence that writer has made was not having enough information. The writer did not start paragraph by saying that there are more drawbacks of the blood transfusion than the benefits. So whatever information he has given is also given in a way where he has used tentative words, is suggesting that blood transfusion could carry more risk. So writer himself is not sure whether the risks are more or the benefits are more. Neither do the studies which he has cited. That is the reason further investigation, further research is needed, because it came to medicine without having the same kind of research scrutiny. So that is the inferential meaning that you get. And that's what I said in the beginning. The paragraph may not have the exact word that you are looking for. You will go for the inferential answer choices. Okay, so here the writer starts by saying that research up to now has been far from comprehensive, and then he gives an example that whatever we have is the restrictive transfusion study, where the transfusion was only given if a patient's hemoglobin levels dropped to the certain level, okay, did not appear to leave the patient any worse off. So whatever findings we have, they show that there was there was no difference in terms of, or there was no such improvement that we could see after the blood transfusion was given. Okay? And then the writer himself goes on to say that what is the ideal way in a perfect world, however. So then the writer is giving a ideal situation. If enough research hasn't been done, then what should be done ideally? So the writer says that, yeah, what should be done ideally is that we should have three kinds of groups, okay, and the blood transfusion should be given to one group, the other group will receive a placebo, and the other group will receive no transfusion. And then the writer goes on to say that such kind of trial, okay, would never get approved, would never get approved. So one of the micro skills that we learned about reading part C is the difference between certainty and probability. This can happen quite frequently. So here the writer has used probability, that it would never get approved, would never get approved. It hasn't happened already, but this is just a hypothetical statement. Yeah? The writer is writing what should ideally happen. So it is just a hypothetical statement. And then he himself justifies it, that why such kind of trial would not get approved is because you will not risk giving blood to someone who doesn't need it, and it is not possible to do a clinical trial. Okay? So therefore the correct answer for this question happens to be C. It hasn't been possible to follow accepted scientific principles, because this is the ideal way in which it should happen. This is the ideal way, but it can never happen because such kind of trial would never get approved. And this would never get approved helps me to rule out answer choice here. B. Approval for a full clinical trial has been repeatedly withheld. So has been repeatedly withheld is certainty, whereas what the writer is giving in the paragraph is probability, not certainty. Would never get approved. That is about future, right? It hasn't happened already. But writer is assuming or making assumption that it would not be possible, would not get approved. Then Why answer choice D is wrong? Because it is clearly contradicting what is given in the paragraph. As you can see, it says adequately representative. Again, here, when you look at the reading part C, it is just like listening part C, will not straight away give negative. It wouldn't say it is not comprehensive. But if you say far from comprehensive, the expression is the same, isn't it? The expression is the same. But if they say not comprehensive, it is easy to understand. If we say far from comprehensive, and if you don't know what is far from, then you are easily going to get taken away by the word comprehensive. You might think it is comprehensive. If you are not familiar with this expression, far from comprehensive. So hardly, little, rarely, seldom, okay, few, little, those words have negative connotation and they are commonly used instead of straight away saying not representative or not comprehensive. And there's nothing about financial resources as such. So A can be straight away ruled out. So C is the correct answer. And let me see in the chat box how many of you could get it correct. Okay, okay, a lot of you. That's good. Very good. Okay, so now moving on to the next question. So here it is for those patients who opt not to have a blood transfusion. You see, always in reading part C, that is the reason why in reading part C you always have questions at a, you have all the whole paragraph and then you have the question. This is how it is different from reading part B. In reading part B, all 6 paragraphs are separate from each other and there is no interconnection there. Whereas reading part C is the whole paragraph as a single paragraph and then you have questions. So the paragraphs are interlinked. So in the first paragraph, writer said there are benefits, but he introduced the idea that now we have started appreciating that there are some risks as well. In second paragraph, writer went on to say that we do not have enough data to say whether the risks are more or the benefits are more. So we need more research. In third paragraph, writer said that whatever research we have so far is not adequate. Why? Because it is not possible for us to do the research. So now if it is not possible for us to do the clinical trial, what is the next way? That is why see this paragraph is starting with another way of testing the pros and cons of blood transfusion involves consent. So where you would use the data from those patients who have refused to get blood transfusion because of certain reasons. Such patients have inadvertently served as a sort of test case. So now we can't do the clinical trial, we can't do the study. So, what is another alternative for us is that we take one patient as a test case. Okay, and then they've explained how such situations have made sure, or such situations have given us results that patient makes a better than expected recovery following surgery. So in this entire paragraph, what is the writer's viewpoint? Is it in favor of blood transfusion or against blood transfusion? The overall paragraph, is it in favor or is it against the blood transfusion? Or is it more about the benefits or the drawbacks? I want everyone to participate so that I get the concept check. Is it in favor or against? Against? Yeah. because here they have mentioned it, that in fact when the blood transfusion was not given, in such cases, in this situation, in such cases where the blood transfusion was not given, patients made better recovery. And here also when he says that the transfusion itself was doing more harm than good. So although you have however here, this however is not connecting two opposite ideas, right? This however may distract you. You might think that this is neutral opinion about benefit and about drawback. No, this entire paragraph does not talk about benefit as such. Both the points are giving out information about the drawbacks. The only difference is the interpretation is different. Here they thought that why they made good recovery is because the surgeons could improve their skills. That could be one reason, and another reason is the blood transfusion itself. The blood transfusion could be doing the harm, and that is why when we didn't give it, the recovery was much better than we gave the blood transfusion. So these are the two interpretations. So they are not two opposite ideas that are presented here, and with that I can easily rule out the D option. Debates among medical professionals. There are no debates as such because all the those test cases have proved that they made better recovery than expected. So there is no such debate as such, but there is different viewpoint that there could be two possible reasons why they did better than when the blood transfusions were given. So one reason is that probably the surgeons proceeded carefully, cautiously. Or another reason could be that the blood transfusion was somehow doing harm to them, and that resulted in the problem. So the correct answer here would be, here we are using the test case, right? So we can rule out the answers which are in favor, like general benefits of the procedure, that can be ruled out. And A is therefore the correct answer. May have developed surgical skills. So here, if you see certainty and probability, see both the paragraph as well as the answer choice have probability in it. The paragraph also tells you that have suggested that the option of transfusion being unavailable may have led surgeons. So here also it is an assumption, and the answer option is also an assumption. Therefore, that is another viewpoint, or that is another reason why I could select A as the correct answer. Why not B? Because it says it was used as a data for ongoing studies. The writer has already ruled out in the previous paragraph that it is not possible to do studies, and therefore another way. So now we are not looking for studies anymore. Okay? We are talking about another way where we use one patient as a test case. It is not that we are gathering the data of such patient and then we are doing study on those data. No, we're just considering that one patient who refused as a test case, and then we are gonna see how we are benefiting or not. Right? So we did 3 questions. Um, Let me know how many of your answers were correct out of 3. If you could get 2 correct, that is a fair performance. If it is 1, then poor. Probably you need to use appropriate strategies next time. Less than 3, 2 is good. Yeah, 2 is good. 1 correct. That means you need to probably review the strategy video again that we did last time, and then probably practice more with the correct strategy, not matching the line with the paragraph. Okay, so enough. Now we are moving on to the next questions. Okay, so these are the question types which are slightly different from attitude and opinion questions. You will always have such questions in reading part C where there is one reference question, reference link question, which means words like this, it, the, such will be used. And then you will have to find out why is it used there or what is it referring to. And you can have a vocabulary question. Now, vocabulary question means you can have a word or a phrase or an idiom used there, and you have to find out the contextual meaning of that word, phrase, or idiom, which means you are not looking for the dictionary meaning of it, you're looking for the contextual meaning of that particular word. Now, let me teach you what strategies do we follow while dealing with such questions. So, the first question here is reference link. It says, what does the word this refer to? So when you are trying to do reference link question, you know that you use this, that, the, such for things which you have mentioned earlier. Right? So let us now read here and see why has the writer mentioned this. So what is the topic sentence of this paragraph? When it comes to extracting and identifying the negative consequences of blood transfusion. So now the topic sentence is about identifying. So far we were saying that we do not have enough clinical research, so we don't know, we don't know, we don't know. So now if we don't know, okay, then what is another way? Do we have any way? So we looked at another way, that was test case. So now this paragraph says, when it comes to extracting and identifying the negative consequences of blood transfusion, this is mainly about negative consequences of blood transfusion, medical researchers still have a challenge ahead of them. That means it is difficult for us to identify the negative consequences. The second sentence says the reason. So see, it is not just for the reference link questions that you need to link this the to the previous sentence. It is in fact to all the sentences that you would have, they would have some connection with the previous sentence. So having familiar or having familiarity with the reference link question it is very crucial for overall understanding of the paragraph. So the reason, now the reason of what? Why we can't identify negative consequences. The reason is that, so this is the reason, if someone is considered sick enough to need a transfusion, there is a good chance that they are already in a bad way physically. And then this sentence comes, this makes it virtually impossible. That means this, first I have to find out whether the word this, it, the is used as a subject or as an object. So here it is used as a subject of this sentence. This makes it impossible. So makes is verb. I have to find out what makes it impossible, isn't it? I have to find out what does this refer to. So what I do to find out this meaning, what makes it virtually impossible, is I go to the previous sentence, because always the word this, that, the will be used to represent the idea that was mentioned in the previous sentence. So what makes it virtually impossible? It is given here that the patient may be already in a bad way physically, and that makes it virtually impossible for us to differentiate negative consequences. So with that, I get the answer that the word this here, right? What makes it virtually impossible is the patient's state or the patient's health. So that gives out D as the correct answer, the state of health of a patient receiving a transfusion. Because of that, I cannot say whether the negative consequences are because of the blood transfusion, or is it their own health? Is it the result of the illness or trauma that led them to receive the blood transfusion? Right? So this kind of questions will require a slightly different strategy. You will have to find out the meaning in the context, and therefore, if it is a reference link question, you go to the previous sentence, because the reference link question will be representing the idea of the previous sentence. Then you find out whether in that sentence the reference link word is used as a subject or as an object, because it will be definitely a noun. So it could be subject or object. It cannot be definitely verb or adverb or adjective as such. So that would help you. Now, it would be okay in reference link question if you don't read the whole paragraph. So if you don't read the half of the paragraph, it is fine. With this, you can get the answer. But when it comes to the idiom or phrase or a word, even though you have to find out the meaning of this particular word, it is important that you understand the context of the whole paragraph, because you're trying to look for a contextual meaning of that sentence. Right? So here what is being discussed so far is that it is difficult to differentiate, or it is difficult to identify the negative consequences. And why it is difficult, that is discussed so far. Now, in the next sentence, writer says, what is known is that, so we have some information because it is difficult to identify, but still we have some information from the observational studies. What is that information? That they may develop infection, or they may need artificial ventilation, or they may need intensive care after receiving blood transfusion. But then again, the writer says such evidence. See, again, such is the reference link word here. Such evidence. Which evidence? The evidence that we have from the observational studies is tenuous, to say the least. Is tenuous, to say the least. And therefore, the jury is still out. So, what do I do in reference link question is, I read the whole paragraph, then I look at the supporting, I look at the linkers surrounding that word or a phrase. So I have a linker here, therefore. Therefore, the jury is still out. Okay. So reason is already given. What is the reason? Such evidence is tenuous, to say the least. And therefore, that means this is the effect. So now if we do not have enough evidence, okay, tenuous means a very weak or very fragile. So the evidence that we have is a very weak evidence. So if we have a very weak evidence, what can happen as a result? That is what the word jury is still out is referring to. If you do not have any evidence, you may not be able to reach any conclusion, right? So the linkers help you identify. If there is, however, that means you are looking at two opposite ideas. If there is therefore, you are looking for cause and effect. So cause is already given, that whatever evidence we have is very fragile, and therefore what is the result of it? The jury is still out. That means probably we still don't have the conclusion of it. And conclusion of what? About the negative consequences of blood transfusion. So here also the question is saying to stress that the negative outcomes of transfusions. Okay, so what is being highlighted here is that they are difficult to isolate with any certainty. They are difficult to isolate with any certainty. The jury is still out because we have not yet been able to get any conclusion from it. So these two questions will require a different strategy. Here you don't go for the topic sentence or the summary sentence or the other strategies that we just applied for opinion and attitude questions. So the question, each question type will require a different strategy. So what I would like all of you to do now is, the next is, we are going to deal with two more questions with opinion and attitude types. So we are going to do that right now. And then I would want all of you to do the whole passage as a homework. You will be able to find that on Teachable. The page I'm sharing is from Teachable Reading Classroom section, test 2. So we have done one passage here and one more passage is there, which all of you are supposed to do as homework. And this time you would also do this reference link question and the vocabulary question. Both these questions are also to be done. Okay. And for now, we are going to do the next two questions. Again, this time, This time I would give you 2 minutes time, so a total of 5 minutes time to deal with both the questions. So approximately 2.5 minutes time for each question. Right? Make sure you are applying the strategies for opinion, attitude, and main idea questions. Go ahead. So that's 5 minutes time. I want all of you to send in your answers privately through the chat box. Okay, so almost everyone went with B in question 7. Okay, 1 or 2 A's, otherwise almost everyone is with B. Yeah. Okay, so again, you could not identify the main point that writer is trying to make here. You see here, it says, question is saying, why has this example used? The question is not asking you about the transfusion during kidney. This is a purpose question which tells you, why is the writer mentioning blood transfusion? What point is he trying to make with the blood transfusion? So you know that so far the writer has been discussing the negative consequences. That means if this was a new point of view, or if this was a different point of view, writer would have started this paragraph with however, or although there are negative consequences, there are some benefits as well. But writer hasn't started this paragraph in that way. He is in fact saying that a growing body of research from laboratory and animal studies is giving insights into what transfused blood does to the host body. See again how it is linked to the previous paragraph. In previous paragraph, writer said it is difficult for us to identify what the blood actually does to the host body. But now he says that we have some of the research data that is telling us what it does to the host body. Then the writer is citing this example that in these were used once for kidney transplant. So then the writer is trying to say that this fact, this suggests us what point he's trying to make here is that it is somehow modifying the host immune system. So modifying the host immune system, do you think it is a benefit? Is it the benefit that blood transfusion modifies the host immune system? No, it's not the benefit, because it's they have mentioned here that it could be a desirable effect in kidney transplant, because you are trying to suppress the immune response. So probably in kidney transplant it could be helpful, but it is less desirable if patient is already in intensive care because of an accident, or if the patient is already physically vulnerable. So do not forget that reading part C is whole a single text, and at no point the writer would deviate from his main idea. So what is his main idea right from the beginning is the negative consequences of blood transfusion and the fact that we do not have enough research. So he's trying to fetch the data, whatever we have, and he's trying to make some assumptions as to what the blood transfusion could be doing to our body or to the host body. So here the writer has given suggestion that it was once used in kidney transplant. So definitely maybe in kidney transplant it was used for its beneficial impact. But question is not saying why was it used in kidney transplant. Question is saying what point is the writer trying to make with the example of kidney transplant. So this is how you deal with purpose question. In purpose question, you don't get taken away by what the writer has given as an example. You are trying to find out what is the writer trying to prove through that example. What is the writer trying to prove through that example? So the whole passage is not about kidney transplant or blood transfusion in kidney transplant. We are looking generally at the benefits and drawbacks of blood transfusion. And by now, you know that he's mainly focusing on the negative impacts of blood transfusions, isn't it? Right from the third or fourth paragraph, it started more about the negative impacts of blood transfusion. And it was almost clear that it is not doing any good to the patients. And then here he used that example and he clearly said that probably in kidney transplant it could be a desirable effect, but it is definitely not desirable if the patient is already vulnerable. And we are mainly looking for blood transfusion for other patients. We're not looking for the blood transfusion only for kidney patients. So benefit is completely wrong with this. And if I say mistaken assumption, that has been corrected. So it is not a mistaken assumption. It was true. But now we have gotten into the, it was true that it was, reducing the rejection, or it was reducing the chances of rejection. So assumption was not mistaken, but the use is now being questioned. So A is the correct answer. A use of transfusions that has now been questioned. We used transfusions once to suppress the host immune system or to reduce the rejections, but now it is being questioned. So A is the correct answer here. And for eighth question, just a moment, it is taking a while to change the page. Okay. So again, eighth question was about writer's opinion. Writer highlights a problem regarding. So if you look at first sentence here, it is not writer's sentence. There is also the suggestion that this is not writer's opinion. This is others' viewpoint that writer has taken into consideration. That more blood a patient gets, the more problem they are likely to have. But writer is denying that. However, even 1 unit of blood is enough to cause problems. So such concerns may be misplaced. And then the writer is saying that storing donated blood outside the body changes it. So it is not about how often a patient receives blood transfusion. It is not about how much they receive, because writer says 1 unit is enough. And it is not about how long it is stored, because they have said more significant is the fact that storing donated blood outside the body changes it, not for how long. Not for how long. So C is the correct answer here. How donated blood is stored before it is needed for transfusion. How represents this outside the body. You may think that they haven't given the way in which it is stored, because writer says it really doesn't matter in what way you are storing it. The fact that you are storing it outside the body is changing it. So not the way in which, but how it is stored. Right? So C is the correct answer here. Not how often, not how much quantity, not length of time, because it doesn't say that if you store it after 24 hours it changes, or after 12 hours it changes. The fact that it is stored outside the body changes it. So this gives me the answer as C. C is the correct answer here. So if you will be able to apply this strategy, I'm sure your score for reading part C would improve definitely. Let me know, out of 7 questions that we did, first I did for all of you, and two questions I did for you. So total of, I think, 5 questions were there which you did on your own. So how many were correct out of those 5 questions?